Unfortunately, erectile dysfunction commonly affects the health of men and their relationships. Sexual contact is a very important part of any romantic relationship, and when that's lost, oftentimes the partner feels that he or she is responsible for the erectile troubles that have developed, when in fact that is not the case. Erectile dysfunction is a blood flow issue. It's a vascular health issue. And so addressing that can really help with the health of the romantic relationship among couples. Unfortunately, for men and for women, it is very normal for hormone changes to take place throughout our lives that commonly lead to a decrease in sexual desire. So this is a very common thing among men and among couples, and something that we have lots of options to evaluate and to discuss, particularly if that decreased desire is very bothersome for couples. I think it's always important for couples to be open and honest with each other about the health challenges that they are facing. And when the health challenge relates to erectile dysfunction, which of course affects both members of the couple, it's even more important to be open and honest about what's going on and to involve each other in the treatment decision. That's going to be the healthiest way for us to decide together as a team how to move forward in the way that's best for each man and for each couple. I think the first thing to be aware of is how common erectile dysfunction is. We know that 50% of guys in their 50s, 60% of guys in their 60s, 70% of guys in their 70s are going to develop erectile dysfunction. And we know that this is a blood flow problem. This is not related to interest or desire in most cases. It's simply an issue with blood flow. And so I think it's very helpful for partners to be supportive of men who are having this issue and supportive of them seeking help, because we have options to improve things and to help improve that part of the relationship. In the vast majority of cases, erectile dysfunction is related to a physical issue, most commonly related to blood flow. Oftentimes in my office, through history and physical examination, and then through something called a duplex penile ultrasound, I can evaluate the blood flow coming into the erectile bodies for men who are having erectile dysfunction. And in that way, we can determine whether erectile dysfunction is related to a blood flow issue or possibly whether there are other avenues that need to be explored. Depending on the cause of erectile dysfunction and depending on a man's other medical problems, there are different treatment options that might work best. So we take these things into account in a discussion, a collaborative discussion about how we move forward and what the best treatment options are for each individual man. You know, penile implant surgery restores the erectile function. It does not change interest or desire, and my observation among my own patients is that what the penile implant really does is restore that healthy contact and sexual contact between couples back to the way that we want it to be. Typically, we don't see that guys are chasing their partners around the house any more so than they would have been otherwise, but simply restores that opportunity for that type of sexual contact and that type of closeness. When a man develops erectile dysfunction, it can be very impactful psychologically. If he's not confident that he's going to be able to proceed sexually, if he's not confident that he's going to be able to develop an erection, he's likely going to withdraw and not want to initiate sexual contact because there's nothing, quite frankly, more embarrassing than being at that point and being unable to perform. So that doesn't mean that the desire isn't there. It doesn't mean that the affection isn't there. It's just that he's scared that he's not going to be able to perform. And that's where we can really provide some solutions that we know are going to be effective at the time that we want them to be effective to restore that healthy sexual life. Patient and partner satisfaction rates are higher than 95% with the penile implant procedure. That is to say, yes, the implant feels natural to partners just as it does to the men who have them. That's a very important thing for couples to understand. It's very important to know that the penile implant will continue to provide the same sexual pleasure as our quote-unquote natural erection does. I would encourage any couples who are experiencing these issues and who have further questions about erectile dysfunction treatments in general, or certainly specifically about the penile implant, to come to the office, hopefully together, so that we can have a comprehensive conversation about these issues and about the options available to us. Certainly, I have helped many men and many couples through these issues and would be happy to discuss these things further in person.